Immunizations given at certain times help prevent us from contracting dangerous and infectious diseases. Being aware of the common causes that might end up in a dangerous infection is very important. Tetanus, or often commonly called lockjaw, is a bacterial infection that attacks the muscles and the nervous system. Clostridium tetani is the bacteria that causes tetanus, and this infection can at times also be life-threatening. This particular bacteria generally lives in the soil and dirt, and enters into the human body even through small wounds or cuts. It then makes a toxin there that affects the nervous system and the muscles, leading to a spasm in the jaw or certain muscles. Now, this bacterium can enter the body through smallest of the wounds and even by pricks of thorns. The illness and the symptoms, however, may take as long as months to develop. You might even forget about the small injuries which might be the cause of the problem later. The symptoms for tetanus may include headache, muscle stiffness, starting in the jaw, progressing to the neck, the arms and then the legs or the abdomen, trouble swallowing, restlessness, fever, sweating, palpitations, high blood pressure, or an abnormal muscle stiffness of the face causing a strange smile or grin. If not taken care, this might become fatal also. This is the prime reason we are briefing you about the caution that you must maintain while you get hurt. You must be proactive enough to get your immunization for tetanus prevention well in time. The routine immunization against tetanus was not introduced until 1961, and so the schedule should be appropriately chosen after consultation with your health specialist. The shot is usually given on the shoulder muscle. The vaccine helps prime your body against the toxin the bacterium produces, and protects you at the time of the actual infection. As per the WHO recommendation, to be protected throughout life, an individual should receive 3 doses of DTP in infancy, followed by a TT-containing booster at school entry age 4 to 7 years, in adolescence 12 to 15 years, and in early adulthood. The routine combinations are: for children less than 10 years of age, usually part of the combined diphtheria, tetanus, acellular whooping cough, pertussis, inactivated polio vaccine, plus Haemophilus influenza type B, DTaP, IPV, Hib. For young children, a preschool booster combination of diphtheria, tetanus, acellular whooping cough, pertussis, inactivated polio vaccine. For adults and teenagers, a combined tetanus, diphtheria, inactivated polio vaccine (TD, IPV) is normally used. Those who have not received any dose for the past 6 months, in case of a recent injury, must consult their physician for a booster dose. There might be slight side effects of the vaccine like soreness, redness, swelling, mild fever or fatigue and body aches, which usually disappear on their own. Severe allergic reactions are rare, but in case of severe breathing distress, nausea, vomiting, skin flushing, low blood pressure and fast heartbeat, rush to your nearest healthcare specialist for immediate consultation.